a chest problem, especially if I'm stressed too much, or if I'm overthinking or thinking about things that happened long ago, what could it be? So this could actually be a sign of anxiety. So you may find that your heart starts beating fast, you start sweating, chest pain, chest tightness. Those are all signs and symptoms of anxiety. So I would recommend that you see your healthcare provider, and or you can speak to a family member, speak to a counselor, see a psychologist to help you deal with whatever issues are causing you the stress. Psychologists, people think, are for crazy people or people who are not coping in life. Sometimes it is good. It might not even be many sessions, but once in a while, see a psychologist. They help you with coping strategies for that particular thing or that particular phase in your life. Can a beard cause an infection? So there are infections that can occur to men who have beards. It's important to keep your beard clean. You can get bacterial and fungal infections from having a beard. There is something called tinea barbae or barber's itch. It is actually a fungal infection or ringworm on the skin under the beard. So it can occur on the neck, the chin, or the upper lip. So it can be caused by sharing of razors. It can be caused by touching somebody with the infection and then you touch your own face. It is important to keep your beard clean and dry. So after maybe exercising or a heavy sweat, make sure you maybe wash your beard, make sure that it's clean and dry, because a fungus loves a warm, wet environment. And obviously under the beard, it is dark and warm and wet. So if your beard is clean and dry, it decreases the risk of this tinea barbae or this skin fungal infection or ringworm of the skin under the beard. You can treat it with a cold compress if it is really inflamed and infected. So you just put maybe a cold cloth and press it on the lesions. You can also use over-the-counter antifungal creams. It should work within 1 or 2 weeks. If it's not cleared up within 1 or 2 weeks, please do consult. So you can come through and we can give you the oral antifungal treatments. There is also something called folliculitis, which is inflammation of the hair follicles. And you can also get razor bumps. So that's quite common in people of African descent with coarse thick hair, or people with coarse thick hair. So both this tinea barbae, which is the fungal infection, and the razor bumps, common in people with very coarse thick hair. Men of African descent or people with very coarse hair, it's not recommended to have a close shave because you do have a risk of ingrown hairs, which is what causes the razor bumps. So you can trim your beard, make it quite short, but try and avoid a close shave because it increases the risk of having razor bumps. There is treatment, obviously, that we can prescribe for razor bumps. You can come through and we'll prescribe that for you. My periods have gone AWOL for 2 years. Okay, periods that have gone AWOL, or we call it amenorrhea, meaning you're not menstruating. Could be a number of factors, including the possibility that you are not ovulating. So it's important that you see your gynae or your GP. You can come through, we do your hormonal screen or test to see how your hormones are balancing and what could be the cause of not having your periods. Also remember that it also depends, are you using contraception or not? Some of the contraception are known to cause amenorrhea or no menstruation for an extended period. For example, the Depo, there's a 2-month one and the 3-month one. They are known to stop menstruation, and it's normal. It's a known side effect. The Mirena works in a similar way, so you might not menstruate with the Mirena, but you could. And then the Implanon as well, the one that you put in the arm there. Some people don't menstruate, which is a known side effect because they've got similar hormones to the Depo. So if you've been on any of those kind of contraceptions, it's possible that you won't actually menstruate for some time. Remember that if you are using them, it can take time to get your fertility back. So it can take up to 2 years for it to work out of your system.